well.
Good idea.
All right, beautiful. So you're having an adjustment after
Too long.
too long?
Like 2 months.
It's been months. Wow. Yeah, that's since you went away.
Yeah.
All right, let's start with the legs. The legs are looking all right, actually. It's not too bad, just slightly short on the side. And then when I bring that up, it looks even. But I still like to check your knee joint and ankle joints and clear any dysfunctions there before I go to your lower back and check your pelvis and sacroiliac joint. People can see us.
And maybe turn the music down so...
Yeah, good idea. I'll just... Had a little bit of fixation through your left fibula, and I corrected that with the activator. Seems to be nice and even now. Beautiful. There's tension through your left sacroiliac joint. Do you feel any tenderness when I touch this one as opposed to the right side?
They're both kind of the same.
Okay. I mean, your lower back seems pretty good. I'm sure I'll find more fixations and stiffness through the thoracic spine and cervical spine, but I just wanted to clear any dysfunctions down the bottom, and then I'll move my way up. My freezing hands. Right thoracic spine and the right side of your rib cage is actually sitting higher than the left side, and I can see that in on that video from this angle, live YouTube live. So obviously we know that you've got scoliosis or curvature in your spine, in the thoracic spine towards the right, and because when there is a dysfunction or fixation in multiple segments of the thoracic spine, that scoliosis can become more prominent. So we want to address that.
There's this picture I took in Europe where I'm like, kind of my arms are in like a prayer position and you can literally see my shoulder. it's so much
not
higher.
aligned. Yeah, it's uneven.
So bad. And it's so weird because the pain started, like the tenderness started on this side, like around there.
And then the
but
right
it was like
side.
kind of
Yeah.
sore through there on that side.
I can definitely tell just by looking at that camera. This side is sitting higher and this one is curved. Like this side is curved and this side is flat.
Yeah.
But no problem. I'm going to fix it as much as we can, obviously, so we restore movement and function back into the joints. Is that tender on this side at all?
Not as much as the other side.
Sure.
Both my traps are very sore though.
Just going to use my new tool that I have ordered before. Your neck feels really stiff,
It's so bad.
especially on the right side again.
Yeah.
Alright, I work on that a little bit more when you turn onto your back. Okay. Take a deep breath in and out. Good. Good. Beautiful. Turn onto your right side.
My nose punched out. Which side? This way?
This way, yeah.
Oh my god.
That's a huge one.
We got them out before.
Yeah. Move the camera to the side.
Maybe down a little bit. Yeah. This one.
I only have to, like, I normally make a gap. Like I've got your whole face.
Show the camera.
She's got her whole face. Printed on the paper. Alright. Let's check your neck. Actually, something like this.
You need me to pull my hair up?
No, that's alright. Your temporalis muscle is really tight on the right.
They're so sore.
Open your mouth. Okay. Yeah, there's a deviation towards the left side, so there's a dysfunction on the right.
Mm. That might be my mum.
She's super early, the first patient. Open your mouth. Open halfway. Messed up your makeup.
That's okay. That's so sore as well. Everywhere's sore.
It's connected now. Alright, let's check your first rib. Alright, your whole back is red now because of all the massage. Alright, bend your head down and up again. Down again. I can see there is a bit of a hump through your lower cervical, so that could be because of looking down on the phone and not maintaining a great posture. So just going to work on that a little bit and mobilize that cervical thoracic junction forward. All right, that should be all good. Try and keep your head, yeah, that's better. So it would be good to have a question and answer or a live around how to maintain a good posture when we're sitting down, like when we're scrolling on our phone or when we are working at the desk. So that could be a good topic.
Can I reverse the hump?
Yeah, to reverse the hump and how to overcome. Beautiful.
Thank you.
No worries. Okay, great. Do we have any? The chat is open.
Did.
We can go through some question and answers if everyone has got any.
If you guys have any questions about posture, I might ask some questions.
Yeah.
Myself. What causes that hump from looking down? What is it?
So the cervical spine. I'll break the slide to show you. So our spine has got some curves, and they are the normal curvature of the spine. So when we're looking at the cervical spine, there is a curve in, lordosis we call it. And when we are looking down on our phone or concentrating, that curve basically becomes straight, and the cervical spine needs to compromise, and there would be basically a loss of lordosis, and then gradually that C7, which needs to be prominent, becomes more prominent. And I get patients coming in complaining about that C7 is sticking out, and they can actually see it more prominently. So that's because of a loss of lordosis or a loss of curve in the cervical spine, which makes the C7 segment to stick out even more than what it should. Normally it would be good to take an X-ray and see whether that's been affecting the cervical spine. In some other cases, could be genetic. If you put on weight, there would be some fat tissue building up around C7. But I think in your case it's more to do with your posture than anything else. We can definitely we can definitely have a live around how we can overcome that hump. So if you like, you can join us for the next live. But just to answer your question shortly, something that I would really love and I would recommend to my patients is to use this gadget over here. So you probably have seen one of these before. That helps to regain that cervical lordosis. So you can put it on the floor, and then you lay down on it. You put your neck on that, and you rest. You rest your neck there for a couple of minutes to recreate that lordosis in your cervical spine. So that could be a really good tool to use.
We have a link to one of them. I might put it in the description.
Yeah.
So you guys can buy one if you'd like.
Yeah, you can order it on Amazon or online as well. In Australia, Kmart should have it as well.
How long should you lie on that?
Just a few minutes, up to 5 minutes, 5 to 10 minutes.
What's the best way to look at your phone or laptop?
So the best way is to basically prevent bending head down for a long period of time. So it's best to bring it to your eye level, so you can rest your elbow on your other hand, and then to support it, and then you bring your phone to your eye level, and that stops you from dropping your head down.
It's my mum.
Oh, okay.
I thought I meal prepped my lamb and I went to leave.
Oh, you
so I'm like,
forgot.
oh, there's no lamb. So she's
Oh,
made some and brought it down for me.
nice. That's really lovely.
Yeah.
Yeah, depending on what.
Maybe read the question.
Yeah.
You won't be able to
Oh,
guess.
okay.
And Instagram doesn't know what the question was.
Yes, so they were asking if chiropractic treatment can help with compressed lumbar spine. It really depends. You have to basically break down what you mean by compressed lumbar spine. So if there is a compressed fracture involved, yes, we can definitely give you treatment, but it would be more of a gentle approach, more of an activator techniques in the surrounding areas and not in that specific segment. And that could possibly give you some relief for sure.
Why would being away and not having treatments have made my scoliosis more prominent?
Well, because, with the long flights, with, probably, beds that they're not supporting of your lumbar spine and, thoracic spine, the mattress,
Yeah.
and the pillow that you've been using throughout your trip, your spine has been compromising. So you've been building up dysfunction and stiffness in certain segments, and that makes any bad curvature in the spine to become more prominent. But when we have the treatment, we try and restore movement and restore function, and that eventually promotes a better health in the spine and also a better alignment in the spine.
Is there other things you can do apart from chiropractic treatment? Like does going to the gym or something?
Yeah, definitely. Movement, going into the pool, some specific exercises which targets different parts of your neck or thoracic spine can also help improving that mobility and flexibility in those joints. And then stretches like those type of stretches, or stretching on the foam roller and things like that can also improve. But having the treatment is more specific and more targeted treatment.
Yeah.
But yeah, very good question. Do we get comments on Instagram?
Yeah.
This is our first time being on Instagram.
Yeah.
Normally we go live on TikTok. So any good tips to help recover, a lower back pain? It really depends on what actually is the cause is, what the cause of that lower back pain is. But usually, listening to your body, giving it proper rest, allowing your body to recover is the best. Using the pool to exercise or walk inside the pool would also help with most of the lower back issues. Chiropractic treatments could be also beneficial. Use of a heat bag or ice pack would also help a chronic or an acute lower back pain. So it really depends on what stage or what phase of injury you're in, and you would probably have different approach.
What tends to cause lower back pain, and then what are the difference between people that suffer with upper back pain? Because I suffer with upper back pain usually, and then some people have chronic lower back pain.
Associated with that upper back?
know like differently. Like some people just have lower
I
back
see.
pain, some people have upper back pain. What different things?
What are the causes of lower back pain?
Yeah.
So prolonged sitting. Sometimes I've had patients who come to the clinic and they've only bent down to pick up something, and they get their lower back pain. They get their lower back locked up. So the causes could be different in different cases, but a disc damage, a normal stiffness in the sacroiliac joint can cause a lower back pain. A poor sleeping posture can also be another cause. If you're sitting down with crossed leg like how I'm sitting for a long period of time, can bring imbalance into your pelvis, and that could cause a lower back pain. Potentially can cause a lower back pain. If you're not adjusting your seat at the desk in the right height, the height of the chair is very important in how your hips and knees are sitting and how your lumbar spine is sitting. Same thing with your car seat. So all those little things would have on your lumbar spine. So if you're not conscious or aware of those postures, sitting posture or sleeping posture can eventually cause a lower back issue. You had another question? Yeah, stretching. They're asking if stretching hamstrings can help with the lower back pain. Certainly. A lot of the times, a twist in the pelvis or imbalance in your lumbar spine and pelvic region can cause a tight hamstring. So stretching the hamstring can definitely give you some relief, but you still need to address the root cause of that lower back pain. But yeah, it's definitely a good tip as well. You can stretch. You can consider stretching your hamstring when you have lower back pain. Another good stretch for lower back pain is stretching your hip flexor muscles. So that could be also a great way to bring a bit of relief in that pelvic girdle area if you're dealing with pelvic girdle pain. Beautiful. I think we should wrap up because we've got our patient waiting outside. So if you'd like to join us next week around the same time, we'll be covering some tips on how to improve your posture if you're sitting down at the desk or if you're scrolling on your phone for a long period of time and you're suffering from a hump neck. We can definitely go through some more detailed explanation about how to prevent it and how to help improve a better posture.
Perfect.
Great. So thank you everyone for joining us. And that was our first live on Instagram. Hope you enjoyed. But we'll be going live on YouTube. So if you'd like to hear more about these tips and exercises, you're more than welcome to join us on YouTube Live. And yeah, hope to see you all again next week.
Do you want me to show the YouTube Live the photo of my scoliosis? Because you can literally see my shoulder.
Yeah.
Up. Thanks for joining, guys. Bye.
Thank you.
It's like incredibly obvious.
Oh, we forgot to bring our teas. We left it in the kitchen. I made us.
So can you see?
Oh, wow.
You can see one shoulder is so much higher than
Definitely.
the other one.
Wow.
Because my friend goes, why is your shoulder doing that? I was like, it's my scoliosis.
Yeah, it becomes more prominent.
Yeah.
Like that. Well, hopefully we can try and...
I'm already feeling better.
Yeah, try and align it as much as we can.
Yeah.
Lovely. We can definitely talk about scoliosis and how we can improve, better alignment in our future lives as well.
Yeah. Well,
Great.
thanks for joining, guys.
Thank you, everyone.
We'll see you next week.
See you.